Medical Monday with me, Deep Rajah. And I started it by saying, quite frankly, look, and maybe you could tell me, we get things done like Botox put in to fill in our wrinkles. We get hair transplants perhaps to make us look younger. But the main area is, if we should we be doing this to service our bodies and keep us living longer and healthier because we're making ourselves feel better, or should we not? How do you feel about that? And have you had patients that have spoken like that?
Yeah, I have actually. So a lot of our patients, come in who want a hair transplant or are looking for Botox for wrinkles, anti-wrinkle injection. So they're looking at, they're looking for these procedures to feel younger or to feel better about themselves, to improve their self-esteem, to increase their confidence. So I don't see anything wrong, particularly wrong about that. If you at the end of the day, our own mental health, our own well-being is paramount, and if we can get these procedures and make ourselves feel better through them, as long as it's done in a safe and professional way and you're open and honest with your patients, then I think it's a good thing.
Have you ever been in a situation where a patient has asked you beforehand, look, should I get, for example, a hair transplant done or should I not? Only simply because they're feeling that, with this debate that a lot of people have, that, I'm born with this, God has given me these looks, what am I trying to do? Have you ever had the sort of guilt treatment or the doubt treatment?
So it depends. So when I'm seeing somebody who's had quite significant amount of hair loss, then and when he is asking, for a hair transplant, I do have to explain that, I can't give you the same hair you had when you were 20, 30 years ago. It's just not possible. It's just we haven't invented that kind of technology. So it's the patient has to kind of weigh up if they're happy with their image at the moment, or if they're looking for something let's say better, should we use that word, if they have more hair on their head. But some people, to be honest, it doesn't suit them, and some people it does. So it really depends on an individual basis, and that person's how they what kind of look they're trying to achieve.
Okay. Just going back to another point here, before we go on to Botox and other GP services that you offer at Komao, I want to talk about hair transplant that you have or that you do. I know that there are prices that are different because everybody's individual. Nobody's arguing there. But when a man gets it done, because it's generally men you work with when it comes to hair transplants, do you feel that they are changed people and the personalities change? They get brighter, better. Do you feel that?
Yeah, I do actually. I do feel that. So, for instance, one case example, one patient that I did a procedure on, he was actually in his early 70s. So, you'd be thinking, wow, to get a hair transplant at that age. But
Mm.
actually, the results were so significant. He himself is a medical. He works in the medical field, and it was just amazing just to see the transformation. Like, his wife is so much happier with the way he looks. He looks a lot more stylish, and he said the way he is working now, it brings his confidence out much more. So, and also, it's very interesting to see the transformation.
I just want to come back to that word confidence, but before I do, 0203 515 1035. Can you call Aman here from the Komao Medical Group and tell me, would you ever think about having a hair transplant? Have you ever had a transplant of hair? And do you feel better for it or worse for it? Or where would you go for it? What would you do? 0203 515 1035. Should we be having this or should we not? You tell me. I mean, I'm trying to find out one other thing, the confidence bit. There's a lot of people who feel a lack of confidence because they have lost their hair. Maybe they feel old. Maybe they feel people are looking at them. Maybe they feel a bit upset about it all. But does this bring back more confidence in men, especially in their way of working, their living, their lifestyle? Does it change them? in confidence ways?
I think it does. Like if I look at my own example, my own personal example, the results I've had from my hair transplant, it's a massive boost. It's a massive confidence boost when you look in the mirror and you see that transformation. So I definitely think it does, especially in this kind of age we're living in, where image is very important, and especially how we portray ourselves to the in the public, with all the social media platforms. So our image is very important, and I think it's important to take care of that image.
Okay, I take that point into account. 0203 515 1035. Guys, let's get talking on this one. Do you agree with this or do you not? And have you ever had something done like that where people have perhaps changed their images in order to suit or gain more confidence? 0203 515 1035. With me in the studio is Dr. Aman Sharma, who is a medical doctor but specializes in scalp treatment, even to a certain extent injuries of the scalp, and also hair loss and how hair replacement, should we say, changes people to a large extent. Now, you may have had a scalp injury, my apologies, a scalpel is a tool, a scalp injury, and your hair in that area has not grown back. Maybe there's a scar. Would you consider or ever consider hair transplant for that scar to be covered, to make you feel better, cleaner, neater? How do you feel about it? 0203 515 1035. I'm going to get back to you on this, but I want to touch briefly on this. Just to move on a little bit. Botox is another service that Komao Medical Group provide. Now, I know I've asked this before, but I think I need to find this out again. Botox is, what is Botox? It's a gel, is it?
No, so Botox is not a gel. That's a different product. That's a dermal fillers, which we don't do. Botox in itself is an injection. It's basically it's like a liquid injection that you inject into the skin to reduce wrinkles. So it's not any collagen based gel. That's a different product. Botox is a liquid that you inject, and it contains a purified toxin that they cultivate from a special bacteria called Clostridium botulinum.
Okay, and what happens then?
So, well, once you extract that toxin, that protein, then you use the Botox to inject into the muscle. So what it does, it prevents muscles from contracting, and because it prevents muscles from contracting, that's how it prevents wrinkles from forming on your face. So we don't just do it for anti-wrinkle injections. We've also shown it works for people who suffer with excess sweating, people who suffer with teeth grinding, and even actually for people who suffer with very severe debilitating migraines. So there have been medical uses for Botox as well.
I want to come back on that point when you said excess sweating. Now, the Asian community have got this problem. We are generally quite hairy people. And one of the key things sometimes is our diets with all the masalas and stuff that we eat. Somebody once said to me, a lot of it comes out in the armpits and places when they sweat, leading the odor to get, well, embarrassing is the only way I can put it. Can Botox eradicate that awful odor that sadly we can't even help starts coming out on the body? Can Botox do that?
Yes, it can actually. So
right. Can you offer that service? I'm going to interrupt you. Can you offer that service?
We can offer that service.
How do you do that, and what do you do?
Okay, so for people who are suffering with this problem where they're sweating a lot from the armpits, and like you say, it causes bad odor, throughout the day, and it's very unpleasant. So we inject the Botox into the armpits, and then by doing so, it inhibits the sweat glands from producing excessive sweat in those armpits, and the effects last for anywhere between 3 to 4 months. So in a year you would need about 2 to 3 top-ups to last you for the whole year. So it's not a permanent effect, but it has been shown to work.
Can you, let's say you get it done because, it's one thing or the other. You're either stuck with the smell all your life or you're stuck with Botox. Can you have Botox all your life, in effect?
For the armpits you can have it. Now for the wrinkle injections, we have to look a bit more carefully at that, because you can't keep getting Botox done year on year end, because your body will start producing antibodies to the Botox toxin. So what that basically means is that you can keep injecting Botox, but it's not working because your body's produced an antibody that cancels the effect of the Botox. So we have to be a bit careful how often and how frequently we do it. Initially we want to do it quite frequently and then space it out over the years, basically.
That's a very good point. Now, how much would a treatment like that cost in your surgeries? But I think more important than that, how long does it take to do?
So the procedure itself is very quick. It doesn't take long at all, anywhere between 10 to 15 minutes. If it's for sweating or for teeth grinding, then a little bit longer, maybe 20 to 30 minutes. So it's not a long procedure, and it's not painful at all either. Cost-wise, we have a various set of costs which you can see on our website, but it's all tailored towards individual needs, basically.
Interesting point there. I'm going to come back in a minute or two, but what I want to talk to you about in a second or two also is when it comes to these sorts of things, what we can do to keep it going, and also what else we need to do for this. My name is Rajah. This is Dilsa Radio. And a very good afternoon to you. My name is Rajah. This is Medical Monday, and we're talking, I guess, Botox, we're talking hair transplant, we're talking lots of things here. But is it right to do this, or should you wait till, you get old and leave it at that? Jatinder, what do you think?
Hi, Deep.
Hello, you're through to Dr. Aman.
Hello, Dr. Aman.
Hello, Jatindra. Hi there.
Okay, I just want to ask you that when people start taking Botox to get rid of their wrinkles, and I think mostly it's women that do this, and when you get a client that's around about 25 or 20 years old or 30 even, and you know that they haven't got that many wrinkles, they don't need to have Botox, what would you do then? Would you still recommend her to do it?
No, I think in that case you wouldn't really recommend. If they don't have many wrinkles, then you would have to you have to assess it case by case. So there are some young people, between their 20 and 30s who do have a lot, but if they don't have many wrinkles, then like I was saying before, you don't want to start introducing the Botox toxin in too soon, because your body will start developing antibodies. So you only want to start using it when the patient really needs it.
So that doesn't that tell you something, that if the body is rejecting it, we shouldn't be putting it into our bodies then?
So it doesn't mean that the body rejects it. It means that if they are, let's say they have a lot of wrinkles and you start using the Botox injection, it starts working. So it does work, but the problem is how frequent you use it. So initially you do need to use it frequently to get rid of the wrinkles. But then if you space it over, a few years, you don't develop the antibodies. You only develop them if you're using it in a way that's not licensed, basically.
But the thing is, what I've seen is nowadays it's coming up a lot, that a lot of these treatments, or I know it's a surgery, right, and operations, that most of the time, there's a lot of cases where it has gone wrong. And the doctors sign this waiver, so nothing happens to the doctor. You tell them in advance that these things can happen, and it's up to you. And they sign it over because they really want to get it done. And because of the way we're living in this world right now, we think that having big lips, having non-wrinkles, and it makes you more pretty and having big breasts and stuff like big bums makes you more attractive, right? So when the surgeries do go wrong and it goes bad, how do we know which one to go to? Who's the right doctor to go to?
I think that's a very good question, Jatinder. A very good question, actually, because there are a lot of people that do Botox and do fillers, and you can get complications with it. And the way to check for it is if you check where they have done the training. One, you check that are they a licensed doctor, because a lot of clinics that do Botox treatment and even fillers, they're not actually medical doctors that are doing it. So it's just simple. You go to the clinic and you check that they have the necessary qualifications, because a lot of these complications arise if you don't understand the anatomy, where the muscles are, where the blood supply is, where the nerves are. So if you're doing it blindly, then you're more likely to lead into complications. But if you know where the structures are, then you
No,
definitely
okay.
reduce the risk of complications.
No, you're saying that having the doctors having the qualification, do your homework before you go there. Yeah, I totally agree on that. You should always do your homework before you do anything. But when you're saying that there's a doctor, if you find a person that's qualified and you're saying that he's the best of the best and he's got all these, I don't know, PhDs and stuff, but they still make you sign this waiver. So that means that there's definitely a risk going to happen when you do these surgeries.
So that I would say that's not just with Botox, that's with any procedure, any surgical procedure. Even if you get, for instance, a knee replacement or a hip replacement, there will always be a risk of some type of side effect. Unfortunately, it's the risk involved with any kind of surgical procedure. And it has to be, you have to inform the patient that these are the potential risks. That has to be informed. But the risks of these kind of complications vary from 1% and to some of the more common
No, no.
complications.
There are heavy repercussions of doing these surgeries, especially when you have from the eyes, when you're injecting Botox into your eye, not into your eye, sorry, around the eye. And if it does go wrong, there's been cases where people have actually gone blind.
So that is not with Botox, that's with fillers. So
Fillers,
yes,
yeah.
yeah. So we don't do fillers at Komao Medical. But yes, that is a complication with fillers, because what happens is that the fillers is collagen, and there's a risk sometimes that the collagen can get into the blood vessel, and you're right, it can cause that. So yeah, we don't
So
do fillers.
what happens to the doctor then when he does this?
So I can't comment on that because that's not something we do. But
I'll
that's
tell you, nothing happens because they signed the waiver.
well, I can't comment on that.
Come on, Jadena, you can't ask that. That comment is a silly question to ask, because you're asking a doctor what happens to him. I'll give you one last comment on this, Jadena. Go ahead.
I just think that it's right in a certain stage to do this, right? Because when people have, I know, like a accident or something, and these things do help them to bring back their beauty back to them. But when there's people out there that don't need it at all, and people are glamorizing it, and you got these, especially young women nowadays, that think having fat lips is the best thing, you know, it makes you more attractive. I just think this is wrong. I mean, there should be an age limit for this, or some kind of medical condition that you definitely need to have Botox to sort your condition out. But otherwise, if you're just going there, it's like putting up a new lipstick or putting up a new eyeliner or something. Let's go and do my lips today, you know. I disagree on that.
Jadena, let me ask you this. I'm going to get a bit personal. Would you ever have, for example, Botox put in yourself?
No, I'm too beautiful.
Right. What about hair transplants? Let's say tomorrow. I don't know what your hair looks like, but let's say tomorrow your hair. Are you bald or have you got hair?
No, I've got hair.
Right. Let's say tomorrow, God forbid it, something happens, your hair falls out. I don't even want to say the C word, but it can happen. Would you have a hair transplant?
Deep, you know, if it depends on how much. You're saying totally, completely bald?
Oh, now I've got you, because that's my point. Some people feel so unconfident and needing these kind of things that it actually
No, Deep,
helps them.
you're going. No, Deep, you're going the wrong way now. Now, what I said
Am
to
I?
you was, is young people. I'm not talking about now when you go bald. Yeah, like I said to you before, if it's a medical condition and you need to get these things done, then definitely, I totally agree with it. But when you're talking to an 18-year-old girl that she's beautiful anyway, you know, when you look at her, there's plenty of beautiful girls who are doing it. Especially look at the models. Even they're doing it. They don't need to do it.
Yes,
They're really beautiful.
You can't
It's
bring
we're
in models.
glamorizing it. You're just glamoring. You know, that's what it is. It's
No,
just
but
glamorizing it.
you can't bring in models, because at the end of the day, that's their job. But Jatinder, lovely to speak to you. Thank you very, very much indeed. You've had a good old chat here with us all. 0203 515 1035. I'm here. It's Medical Monday, and I've got the gentleman from Komao Medical, Dr. Aman Sharma here. Amanji, I want to move forward now, right? I know that we've discussed Botox, we've discussed hair transplant, but there's another service you offer that I'm very, very impressed with, is the private GP service as well. Can you hear me?
Yes, I can hear you.
Can you hear me? Okay, good. Right. Let's move forward now, right? I know that we've discussed Botox, we've discussed hair transplant, but there's another service you offer that I'm very, very impressed with, is the GP private GP service as well. it sounds like somebody like Jatinder would have a real issue getting something like this done. Do you find that with your private GP service, you're able to talk to people and have them understand what to do or how, or whether they really do need something?
I think with private GP, basically, it's about giving the patient a bit more time than they would have with their normal GP. So we can give them that time, so to make sure they don't feel rushed, to make sure that they feel listened to. So these are the main things with private GP, and of course the speed of the appointment as well. So they don't have to wait a long time to get that appointment.
That's what I mean. That they don't feel rushed and stuff. We're going to go back to the phone lines because they're all buzzing away here. Hello, good afternoon. Who's calling me on Dilsa Radio? Hello.
Mr. Anonymous.
Mr. Anonymous, you're through to Dr. Aman Sharma. Go ahead.
I actually have a couple of comments to make, actually. You see, the thing is, I don't know whether you do hair plants or something, but you got some clinics out there. And I had somebody in the family using these products. And they tell you, well, you need to do a massage and you got to do this, that and the other. And then they start making a bill for like £400, £500, £1,000 for some of these bottles. And then they tell you this is very good for you. When you look at these bottles and you wonder, is it gold or diamond in there, And I'm thinking, well, I think all these things comes with caution, the way you use these products. Because somebody needs to understand, if you're taking regular medications, you want to make sure that it doesn't interfere with the system.
I'm gonna hurry. What's your question exactly?
That's what I'm saying. And the other thing is, you're talking about this private practice. When you look at some of these local GP surgeries, like walk-in centers and all, I think it's a bit sad. They said to you, well, you need to make an appointment to walk in. I mean, this is what it's like an emergency service. They tell you, well, you need to make an appointment. And you think, well, do I know when I'm going to break my leg, or do I know when I'm going to get ill? But I just thought I'd make this comment quickly, so at least this is what's happening. Everything's privatized.
Okay, but let me just come back to one thing, Dr. Sharma. I think you'll agree with me on this. Your clinic, I know for a fact, is not a clinic that will just rip people off. And I'm saying that on purpose because I'm not talking about this doctor. Let me answer the other point. The GP walking service. Whilst I agree that you don't know when you're going to break your leg, or you don't know, and they say see me in 3 times. Aman, can you please talk to this gentleman now and explain the use of a private GP then?
So actually, the point you make about the walk-in service is very interesting, because that kind of service that is affiliated with a lot of accident and
whatever they call it.
And accident emergencies in the hospital, I think is there for an emergency. And you're right, it's quite crazy that you have to. It's so busy now. You actually have to book an appointment for an emergency kind of problem. So I do agree with you. The unfortunately the system is very busy, and that's the reason as private GPs we are offering that service.
Yeah, but I think everything's done to do with everything done to do with money now, funding. You see, if you go to see a normal consultant, they say, well, I can't give you medication. You take this prescription to your doctor's surgery. Yeah, but I need this medication. Well, you have to wait 72 hours before you get this prescription. And I'm thinking, well, can you sort out your whatever you need to do at the back of your scenes? I just want a medication. But I just want to mention this quickly. But this is where things are getting now. Okay. It's just we won't mention a lot of things, but it's just everything is going through privatization, and I'm wondering what's going on here.
A very, very good point. I'm going to go more on, because the thing is, the more we go to private GPs, the more you can get your work done quicker. Let's go to the phone lines. Good afternoon. Who's calling me on Dilsa Radio? Hello.
Hello.
Hi. What's your name, please?
Hi. I don't want to give my name. Thanks.
No problem, Miss Dilsa. You're through to the doctor. Go ahead.
Yeah. I just wanted to ask, talking about the dermal fillers and the Botox, what is benefit? What about PRP treatment?
What's PRP?
Can the doctor answer?
Yeah. So PRP, just to explain exactly what PRP is for our listeners. So PRP is basically when we take a blood sample from the patient, we then put that blood vial in a centrifuge to separate the platelets, which are the growth factors in the blood, from the rest of the blood, and then you use the platelets, which have these growth factors, and then it can be used for different purposes, but you can use it to inject on the scalp to increase hair growth. Some people also use it on the face to increase the blood supply to the skin, because they say it increases the elasticity of the skin. We don't actually do PRP on the face at Komao Medical, but there are some clinics that do that. However, we do PRP for hair loss.
Oh, you do PRP for the hair loss?
Yeah.
Right, okay.
Yeah.
All right then, thank you.
No problem. Do stay in touch afterwards. We'll be giving out the number and everything for you to have a chat.
Okay, thank you.
Bye. Let's go to the phone lines again. We're getting lots of calls. Good afternoon. Who's calling me on Delta Radio?
Hello.
Hello.
Is it me? Somebody else?
It is you.
But I mean, when somebody else calls, it's right into your ear, so you have to move the phone away from your ear.
I apologise. We're getting new studios built as we speak, so before you know, you'll be having the Rolls Royce of signals. Shanaz, I think that is. What would you like to say? You're through to the doctor.
Yeah. No, I just needed to know what the doctor says about the actual mechanism. When you do Botox and the muscles can't contract, are you actually paralyzing the nerves? What are you actually doing?
Sure. So what basically Botox does, so you inject the Botox and it prevents the nerves from releasing a chemical that prevents muscle contraction, basically. So you are preventing certain groups of muscles from contracting, and that's the way it works, by preventing those wrinkles or frown lines. And for some medical purposes, it's used to prevent spasticity in muscles. For instance, people with cerebral palsy. But you're not doing it. You're doing it in a controlled way. So you're only targeting specific muscles rather than in a more general approach.
Okay. Well, I feel a bit sorry for the poor nerves, but never mind.
Okay.
Yeah, I mean, I wouldn't like to be knocked out of my function, you know what I mean? But the second thing is, I read somewhere, and the doctor would know it better than me, because I read it some time ago and I've forgotten. Are those things, those things that people give out, like pheromones and stuff in their secretions, like sweat, etc.?
Is that right?
Are you with me, doctor?
Yeah.
Are you with
Did
me?
hear that? He's trying to think of his answer. Hold on.
Yeah.
Hold on.
So you're saying that there are pheromones mixed in with the sweat. Yeah, you are right. There are pheromones mixed in with the sweat. That is something that happens. Yeah.
And is it true that they actually are attracted to the opposite sex?
Well, yes.
Getting a bit steamy.
So you're making people less attractive to the opposite sex.
Well, I mean, everything has to be in balance. So, there are definitely some pheromones in the sweat. But if you're sweating too much, then the pheromones get diluted. And unfortunately, then you just end up with bad BO, basically.
Well, shouldn't you be actually targeting the cause of too much sweating? Because quite honestly, a few years ago, people were not actually closing their noses to their colleagues and things, because you have a shower, you wear clean clothes, and if you wear natural fibers, I don't think you stink. Do you? I mean, you're a doctor, you know better.
So hyperhidrosis is quite a complicated condition. There are two causes: primary, secondary hyperhidrosis. So primary, there's a genetic component where people are just sweating all the time. It's not due to any lifestyle factors. Secondary hyperhidrosis, which I think what you're speaking about, is showering regularly, wearing loose-fitting clothes. Sometimes it could be medication based. So when you screen for patients, you're having to look at and classify what kind of hyperhidrosis you're dealing with. Is it primary or secondary? And the treatment is mainly for primary, not for secondary hyperhidrosis.
Okay, thank you very much. I'm going to have to leave it there because we've got so many other calls coming in. But after this, it's Medical Monday with me, Deep Rajah. Good afternoon.
We buy gold, we buy gold, we buy gold! Gold Bank London. If you want to cash in on the soaring high gold price, come direct to the Gold Bank, 215 The Broadway, Southall. Call 0203 500 1111. Best rates paid by the Gold Bank London.
The hottest new data offer of the year is with Leica Mobile. Now you can get a phone-busting 40 gigabytes of data with UK Plan Mega, plus unlimited minutes and texts and 100 international minutes for just £20 when you buy online. Valid for 30 days and EU roaming included. This amazing offer is available for both new and existing customers when purchased at leicamobile.co.uk. Terms and conditions apply. Leica Mobile.
Attention to retailers and restaurants. Want to see your profits increase and costs reduce? Then you need an EPOS system, an electronic till from EPOS Direct, UK's leading choice for all types of businesses. Now available with 0% finance over 12 months. Call 08000 336 888 or visit eposdirect.co.uk.
वाओ, तुम्हारा घर तो बहुत सुंदर लग रहा है। नई एक्सटेंशन से कितना स्पेशियस भी।
आओ आओ, लॉफ्ट कन्वर्शन भी देख लो। ये सब कमाल प्रॉपर्टी केयर यूके वालों का है।
और कितना जलाओगी? तुम
भी उन्हीं से काम करा लो। वो FMB रजिस्टर्ड बिल्डर्स हैं। फास्ट एंड टॉप वर्कमैनशिप फॉर एक्सटेंशंस टू लॉफ्ट कन्वर्शंस। कॉल प्रॉपर्टी केयर यूके ऑन 0208 611 2913.
Are you building your business or promoting a brand? Do you need new customers? Or do you need to keep your name in the mind of all your customers? Then you need to advertise on Leica Radio 1458 and Dilsey 1035. Our stations cater for a large audience of South Asians who live and work in and around Greater London. Call our experienced sales team on 0207 132 1458 and you can be on air in no time at all. That's 0207 132 1458.
The music you want, the news you need. Dilsey.
So that wraps up Medical Monday for this afternoon, but I will say that Dr. Aman Sharma will be back soon when it comes to the Komao Medical Group and Medical Monday. Very quickly, can you give me your name and address and everything, please?
So it's Komao Medical, KOMAO. You can visit our website at www.komao.org.uk or you can Google us, just Komao Medical. Our email address is info@komao.org.uk. And our telephone number is 0208 749 4640.
Just give the phone number again.
0208 749 4640.
Many thanks for coming into the show. I look forward to seeing you again at some point. And also, there was a question saying, can the psychology of hair transplant be explained? I think they need to come and see you for that.
Yeah.
Take care till then. Very, very lovely to see you and speak to you soon. All the very best, Aman.
Thank you. Bye.
Bye.